Good evening, dear students. Today we will discuss questions from orthopedics. The first question was about a young adult who had a road traffic accident and then he sustained injury to the hip region. The X-ray was given, and now what is the most appropriate management? So if we write the things like young patient, right? Now let us study the X-ray. What we can see in the X-ray. This is the head of femur, right? This is the area of, you can say, greater trochanter. This is the lesser trochanter. Now what we can see, there is a fracture line running like this. So this is a classical case of fracture neck of femur. So the X-ray is showing fracture neck of femur. Now we have to answer like what should be the management here. Now remember, whenever there is a fracture in young patient, it should always be operated and fixed, right? So especially in cases of fracture neck of femur, we have two age groups, right? Less than 65 years and more than 65 years. In this case, like this is the patient which is given in the question, the young patient. Now what we'll do, we have to fix. So we need to do internal fixation. Clear? So in a young patient, the answer will be internal fixation. Now what we do here actually, we use multiple cannulated cancellous screws. So cannulated cancellous screws. You can remember it as CCS, cannulated cancellous screws. So we will reduce it first and then we will pass 3 screws like this. So this is what is approach in young patient, because in young patient we have to preserve the head, right? So the concept is head preservation. Clear? So we want to preserve the head of femur. Now what happens in a case of elderly people more than 65 years? Now what happens, there are more chances of non-union. It means there are high chances that the fracture might not unite despite doing any internal fixation, and that may be related to the osteoporosis or the poor purchase of the implant. So it is better to replace, right? So it is better to replace. So what we need to replace? We need to replace the head of femur, right? So this all part will be removed. Clear? So therefore in elderly the answer will be replacement arthroplasty. Replacement arthroplasty. Now since we are removing only one component of the hip joint, because the other component of the hip joint is acetabulum, so acetabulum is left but only the head is removed. So we are replacing the half component of the hip joint. So therefore what you will add? Hemi replacement arthroplasty. Clear? So this will be the nomenclature in elderly. So in elderly we will do hemi replacement arthroplasty. In young we will do internal fixation. So this is the concept of fixation for fracture neck of femur in young and hemi replacement arthroplasty in elderly. Okay, and the random age which is taken is around 65 years, right? So less than 65 years will be counted as young, more than 65 years will be counted as elderly. So this will be elderly. right? So this is what you need to remember for fracture neck of femur. Then moving to the next question, which is an image based question, and it is being asked like which ligament is tested in the given image. Now look here, what we can see that the patient is lying over the couch, right? So the patient is lying over the couch, the hip is flexed and the knee is flexed. Clear? Now the patient has stabilized the lower limb by putting some weight or sitting over the foot. And now what he is doing, he is trying to pull the upper part of tibia forward. So if we look at the image, what maneuver the doctor is trying to do? So flexing the knee joint. Yeah, so flexing the knee, we can see that. Then holding the leg from upper part. Then what we can see, stabilizing the foot. And lastly, he is pulling the tibia or pulling the leg forward. So he is pulling the leg forward. Now, normally, if the anterior cruciate ligament is intact, then this pulling the leg forward cannot be done, right? So the anterior movement of the tibia with respect to the femur cannot be done if ACL is intact. Now, if ACL is gone, it is very easy for us to pull the leg or the tibia forward. So in this image, what the doctor is trying to do, he is trying to evaluate the ACL, whether the ACL is intact or not. If the ACL is intact, the leg cannot be pulled forward. But if the leg can be pulled forward easily, it means the ACL is torn. So this particular test in which we are pulling the leg anteriorly is known as the anterior drawer test. Yeah, so this is the anterior drawer test, and anterior drawer test is done for anterior cruciate. And look at the degree of the flexion of the knee. This is around 90 degree. Clear? So the knee is flexed to around 90 degree, and then stabilizing the foot here, the doctor is trying to pull the tibia forward. So this is anterior cruciate ligament anterior drawer test. Yeah. So this is what is shown in the image. Then a patient presents with a fracture as shown in the X-ray. Now, which nerve is most likely to be injured? Now, this is one question which has been asked in almost in every exam, whether NEET, PG, INICT, UPSC, everywhere. This is a very favorite, and I think there is no scope of doing any error in this kind of question. This is a pet questions for the examination board, and they always put in some different manners, but the concept remains the same. So now what we see here, we can see there is fracture of the mid shaft humerus, right? So what we can see here, there is the fracture of mid shaft of humerus. Now, if we know the anatomy of the radial nerve, it goes from coming from the posterior cord, it descends down like this, crosses behind the humerus and lies laterally. So this is the course of the radial nerve. Now, why this anatomy is important? Because at times the radial nerve can get injured because of this fracture. So if you see an X-ray which is showing fracture of the middle of the shaft of humerus, the answer has to be radial nerve, as it is passing from medial to lateral behind the humerus, coming to lie on the lateral side. So this is the classical X-ray to show the possibility of injury to radial nerve. Okay, and then there are many questions like what will be the clinical deformity, So if there is radial nerve injury, the clinical deformity you will be seen is wrist drop. Okay, so there is wrist drop. Now how you will manage? Obviously we will give cock curb splint. Okay, so these are some related questions which are very commonly asked. But one should be very clear with this X-ray and the possibility of injury to radial nerve. Now a patient presents with a lytic lesion. A patient presents with a lytic lesion which is ring shaped in some bone, and the X-ray is given. Now we have to comment on the diagnosis. Now look here. Firstly, we need to identify the bones. This is the distal end of femur. This is the tibia, and this is the fibula. Okay. And secondly, what we can see, this is the closed growth plate. So fused physis. So the physis is fused. So it means the age of the patient is a little more than 18 years. Now coming to the lesion, we can see there is a oval lesion, right? And what area? This is obviously epiphysis. Okay. This is metaphysis. So we can see a oval lesion in metaphysis of tibia, right? And this is the lytic lesion, and we can see a white rim which is surrounding the lesion. So there is a sclerotic rim. So it means the lesion is localized by this white sclerotic margins. The moment you have presentation of this kind where there is a lytic lesion in the metaphysis of a bone which is well limited by a sclerotic ring, this is nothing except the Brody's abscess, right? So this is Brody's abscess. It is a form of osteomyelitis. It is a form of osteomyelitis where the infection has been localized. Clear? So the infection has been localized. So this will make sure that the infection does not spread further. It is localized to one part of the bone. So this is Brody's abscess, right, related to osteomyelitis. Then moving forward, an elderly patient had a history of fall on ground and he sustained injury to the hip region. The X-ray is shown. Now let us see the fracture here. So firstly, we need to identify the bones. So this is the head of femur, this is the neck of femur, this is the lesser trochanter, and this is the area of greater trochanter. Now what we can see here, this is the fracture line which is running across the two trochanters. So the fracture line is running across the two trochanters. So it means the fracture line is extending between greater trochanter and lesser trochanter, right? So it is extending between greater trochanter and lesser trochanter. So the fracture is between the two trochanters and therefore it will be known as intertrochanteric, right? It will be known as intertrochanteric because the word inter means between. So the terminology is very easy provided you can mark out the extent of the fracture line which is running across the two trochanters. Now in fracture neck of femur, the fracture line will be somewhere here. So don't write it fracture neck of femur or femoral neck fracture. The fracture should be here in femoral neck. But here the fracture line is running between the two trochanters. So classically intertrochanteric. If the fracture line is somewhere here below the level of trochanter, then it will be known as subtrochanteric because the word sub means below, right? So this is below. So this is how you need to identify a given fracture on an X-ray. Then a 11 days old infant is brought to the hospital and parents say that there is only a single fall. But when we did X-ray, we saw multiple fractures and these are at different stages of healing. Now this word is very important. Different stages of healing. So when there are fractures which are at different stages of healing, so it means the fractures occurred at different times, different period. Right? So the timing of the fracture is different, and that is only possible if the parents are being cruel to the child, if they are beating the child, and therefore there are different episodes of assault or beating of the child. So there are different fractures occurring at the different period of time. So we will see fractures which are in different stages of healing. Clear? So the moment you have this word, multiple fractures, right? So multiple fractures and in different stages of healing. So some might be in hematoma stage, some might be in granuloma, some might be in callus stage. So it means the fracture, they occurred at different period of times. It means the baby was being beaten or assaulted at different period of time. So this word, the moment you find this, the answer has to be battered baby syndrome. So battered means the parents are cruel to the child. They are beating the child or they are doing assault to the child. So this is the important point which will suggest you that the baby has been beaten by the parents, and the parents, they are trying to hide the reality. So they will say that the child has a fall, but if there is a fall, the fracture would be either in a single bone, or even if the fracture is involving multiple bones, all the fractures will be in the same stage of healing. So all the fractures has to be in the same stage of healing if they occurred at the same time. But here different stages means they occurred at the different time, and therefore that should raise the possibility of battered baby syndrome. Then injury to the which part causes difficulty in dorsiflexion of foot? So this question we have already discussed in anatomy. If there is difficulty in dorsiflexion of foot, it means the nerve which is controlling the dorsiflexor of the foot is paralyzed. So paralysis of foot dorsiflexors, especially the anterior compartment muscles of leg, and these are supplied by deep peroneal nerve. Now in clinical practice, isolated injury of deep peroneal nerve is very rare. So in fact, its parent branch, that is the common peroneal nerve, is commonly injured. So mostly we see injury of common peroneal nerve. Now the common peroneal nerve, anatomically it winds around the neck of fibula, and if there is any fracture of the neck of fibula, more possibility of injury to common peroneal nerve. So from the given image, we have to identify which area is the neck of fibula. So if you see, this is the neck of fibula. Clear? So very easy to identify. This is the neck of fibula. So our label G is the answer here, because this is the neck of fibula. So if you know the relevant anatomy, it is very easy to answer. So we can skip the others label from this image. Better focus on the answer only, that is the option G, that is the neck of fibula, right? So this is how you need to reach up to the answer. Then an elderly woman, she was involved in a road traffic accident and there is difficulty in breathing and there is altered mental status. It means she is going into delirium. Now, X-ray is also given. What is the likely diagnosis? So here, key clues are what? Say, elderly lady. There is history of road traffic accident. Now, the lady is having breathlessness. And she's also having altered mental status. So, neurological involvement. So there is involvement of two systems. One is respiratory. Okay, so there is difficulty in breathing, and second, there is involvement of neurology, that is altered mental status. Now look at the X-ray. Which bone is fractured here? Obviously this bone is femur, and we can see the fracture of shaft of femur. Right, so what we can see here, there is the fracture of shaft of femur. So X-ray is showing fracture shaft of femur. Now this all clues, it gives us the possibility of fat embolism syndrome. Now here, this is especially seen, fat embolism, it is especially seen with the fracture of femur, or if multiple bones are fractured, polytrauma, right? So this is one thing. Then secondly, what we can see here, there is a respiratory symptom, there is neurological symptom. Also, we can see rash, right? It can be seen on neck or lower conjunctiva. So, petechial rash, respiratory symptoms, neurological symptoms, especially after fracture shaft of femur, the answer has to be fat embolism. And what happens here? The fat globules from the marrow of the femur, they gain entry into the nearby blood vessels, right? So they move inside the blood vessels, and then this becomes the fat embolism, right? So this is how the fat embolism is very common, be seen in fracture shaft of femur, right? So the answer has to be fat embolism. So this is enough for this session. Thanks for joining. Keep on studying. God bless.